the Las Vegas Valley is experiencing a medical care provider shortfall, as are many parts of the country. Healthcare access has never been more difficult, delayed, and rushed.
And that's why the neighborhood clinic is on a mission to make healthcare more accessible right here in the Valley. We have co-founder and COO Trent Hofmuckel with us alongside co-founder Dan Briggs. Guys, welcome in.
Thank you for having us.
Good. We've been having fun already.
We have.
Yes. You're putting the fun in this conversation for sure. Let's talk about the inspiration behind the neighborhood clinic.
Yeah, no, and thank you for having us. This really originated several years ago when Mr. Hofmuckel and I were discussing the dichotomy between the fact that the United States has the absolute best medical schools, we have the best providers, the best healthcare, and then we also have the most expensive healthcare, nearly $13,000 per individual. You're willing to pay for best in class, but then we realized also that we rank about 30th in the world as far as access to medicine. And so we decided to address this and start understanding where that gap was. And so that birthed the neighborhood clinic as we started to understand truly where the shortfalls were. From there, we started to implement our own program, form this 501c3 specifically to provide access to healthcare that otherwise people have not had. So that leads us to kind of our conversation today and what we're doing in the downtown Las Vegas area, as well as the rural areas throughout southern Nevada.
Right, and I want to touch on that a little bit more, you know, the real importance behind why the neighborhood clinic had to be a nonprofit.
So it's an interesting thing when you start looking at where your health care comes from, right? And a good portion of it here in southern Nevada, particularly those who aren't having the access, they are Medicaid and Medicare patients. A number of providers and a number of institutions are unable to accept that or choose not to. And so a lot of these folks also are what we call place-bound, meaning they don't have the mobility to move and actually go reach a provider. Couple that with the fact that Las Vegas is short 4,500 providers, and you start seeing a real crisis. And so our intention and what we've done is to actually go into the areas that did not have any sort of medical community, create a brick and mortar facility, and be where the people actually need us to be, along with the follow-ups and working with these different managed care organizations to, in fact, get them into the system and use it the way it was intended to work.
And speaking of that brick and mortar, you're inside the Las Vegas Rescue Mission, correct?
Correct.
Yes. What do you think needs to change with healthcare here in southern Nevada? What is it going to take?
Well, I think the first part is what we've started, right? It takes access in general. I also think that it takes more advocacy. So I've heard this from several people, especially a lot of the local politicians, is that you look at lawyer groups and you look at business entities, and all of these organizations are really good about getting together and creating advocacy around whatever is important to them and whatever they're trying to get out into the public facing arena. Medical is still 20 years behind that. They're not good about working together, advocating for change, advocating for things that we can actually accomplish in Carson City, and then in turn extrapolate throughout the state. And so I think that by getting everyone aligned and creating some of these organizational opportunities with like-minded healthcare providers, from physicians to nurse practitioners to medical assistants, kind of the whole nucleus of the healthcare system, then we find a way to better communicate about what the bottom line needs are. And once we figure out what the bottom line needs are, which really honestly start with behavioral health and work our way up to physical medicine, then we actually are able to start figuring out what are the next steps needed in order to create this kind of extrapolated opportunity of better medicine for everybody throughout Nevada.
That's wonderful. And so who would you say is the target patient for the organization's mission?
No, and wonderful answer to that. And I think it leads directly into that, right? As you look through the increase in the unhoused population coming through the pandemic and on the other side, that was our initial driving force, was how do we help these people get back to a foundation of wellness? And you go beyond that and you look at the elderly populations and those that are unable to receive the health care they so desperately need, whether it be here in downtown Las Vegas or throughout the entire valley. So our primary focus has been, okay, how do we go about helping these folks that thus far, in the last few years, have truly been neglected? And so that's been our focus throughout is not only providing the location, providing that consistency so they know they're going to see the same provider, they know we're going to be on site, that we have med dispensing, that we have a laboratory on site, and that we're able to condense everything into a very well-rounded checkup. But also going beyond that is starting to understand how do we create a larger net that encompasses this entire community, because the more people we proactively help on site, the fewer have to go make the emergency room visits and overburden these emergency departments, so that when any of us have a real need, we're able to get that access to care, because it impacts across the whole community.
Wow, it's great what you guys are doing. Real quick, before we go, we want to mention there's an event on June 10th. Tell us what people can expect.
Sure. So on June 10th, from about 7 until probably about 11 o'clock in the morning, there's a family-specific family medicine healthcare event going on at the Las Vegas Rescue Mission. It's in conjunction with the PACT Coalition, which is a great organization here locally that aligns a lot of 501c3 organizations. So just an opportunity for everybody to come out and just learn a little bit more about everything from trafficking to basic healthcare.
Excellent. We have that information we're going to share with people. We have your website up on the screen as well. Thank you so much, guys.
Thank you very much.
Great
for the time.
work.
Appreciate it.
Yes.
Thank you.
Visit the neighborhood clinic at the Las Vegas Rescue Mission for Family Medical Awareness Day. Again, the event is June 10th from 9 a.m. to 12 p.m.
For more about their services, you can also visit thehoodclinic.org.